Namaste, everyone. Hello, everyone. So I'm Srinivasa Madanelli. I'm going to talk about the health data and data platforms. Firstly, about health data and data platform. And the agenda for this discussion is going to be, looking at the macro data for the health, for general understanding, and with that understanding, we can come up with, so it can help us to devise better policies or strategies and outcomes and processes. That is the idea. And what we'll look in little more detail is, understanding the health progress, health in the sense that the public health at large, and then so look at, and also we'll look at the challenges, spending outcomes, and public policy shaping with the data. And we'll also look at the public data platform that can be leveraged for both the local and global purpose. Okay, so and also for all the things, whatever I'm going to discuss the data, they're all sourced from credible data sources, global data, so largely global data sources. And why do we look for such big picture? So I think there should be some good objectives and intention for us, for looking at this data, right? So what I've seen is, often we become very desperate or depressed and hopeless when we see, a lot of people suffer for health reasons, and also this time to time we hear about the sudden deaths, injuries, or going through health challenges, right? And also the health spending on costs have gone up as well. So what is the reality? Is it really getting worse or is it getting better? So that is the main objective of this whole session. um, Unfortunately, majority of us, we really either don't know or we don't realize how bad the situation was just about 50 to 100 years ago. This is not just in India, across the globe and in our regions. So we need to understand the progress in the, which has happened in majority of the areas, and in some cases it has also, we have also regressed. Okay, so we have to look at the trends, what is happening in various areas, and then what are the opportunities that are shaping up, right? And then the threats, we'll have to look at those things as well. Then, end of the day, so we need to be hopeful. To be hopeful, we need to know the reality, then versus now, and how do we kind of how it will trend to the future, right? So to be hopeful, I think this looking at the data much more holistically will help. Though we can be hopeful, and also we need to be really happy about the progress that has happened in the last 50 to 100 years, but we need to be cautious as well. So we need to be prepared and improve further. So no matter how much progress we have made, nothing can be taken for granted. So COVID-19, we know that. So more than 10 million people died across the world, and so despite all the progress we have made, and it crippled the whole world for nearly 2 years, right? So nothing can be taken for granted. Okay. We also need to know how we are doing compared to others. So with respect to how others, in a sense, okay, one country versus the other, one region versus the other, one section of the society versus the other, right? So to do that, we need to look at the data in a macro level, data, and also over time as well. With this understanding of various aspects of health, with the data, it kind of helps us to prioritize what to focus on, and then how much to allocate resources, and what the plans can be, etc. And with that, we can come up with them. So we means the government and general public at large come up with the better public policies, or if you're in a health organization, you can come up with the better strategies, or even in a kind of an NGO serving the community health, they can come up with the better strategies, right? And then programs and implementations. So just to give a little bit of a definition of the policy, it's a government stated strategy to address public issues and harness an opportunity for public good, right? So just so the public policy, or any policy for that matter, will have objectives and why it should be there within the first place. What are its goals? and to how do we achieve those goals with the plans, programs, funds, and stakeholders, etc. Right? And for any of this, creating policies, coming up with the right objectives, goals, plans, programs, and funds, and etc. We need data, right? So that's why the data is very critical. That's what we are going to look at. And for anything, it's not just for health, it can be for any aspect of the society or organization, right? So the health, education, environment, employment, etc., right? So economy, etc. Data is extremely important to know the shape, size, distributions of distribution and trends of anything, right? And this data will also help us to focus, where to focus, what to focus, how much attention and resources to provide, etc. Right? Um, Again, let's look at the some data points, some points on the public data, their life cycles, and the data analytics platform. Right. Typically, the public data on health, is it's collected, analyzed, and used at different levels. So some of them are collected at hospital levels, for each individual patient, and patient data is typically for diagnosis, treatment, and monitoring. Right. And when you have thousands of patients data, then you can see the macro level picture about the various diseases that are there, various challenges people go through in terms of health, and various spendings that happen for these kind of issues, right? And then hospitals will have additional, in addition to patient data, they'll have other administrative data as well. So in addition to the diseases or disorders or the challenges they serve, and they kind of help patients to deal with and cure those diseases or manage those diseases, right? In addition to that, they have to manage their own resources, right? The infrastructure aspects in the beds, the facilities, and all these things, right? So, and the people, right, and the doctors, nurses, technicians, support staff, etc. Right? So for all that, we need data. Hospitals will have the data, in addition to patients data, their own infrastructure and people and process data as well. And time to time, the governments at state, nation, and global level, they collect a lot of data, public health data. So for through various sensors and sample surveys as well. And these things are used for regulatory purposes, policy making purposes, and administrative purposes. They help in terms of understanding where the challenges are, where the progress has been made, and where to focus next, etc. Good thing is that a lot of aggregate data is now available for public usage. Many of the government data platforms have evolved, and they provide a lot of data, a reasonable amount of data. Many times there are access challenges. There is latency challenge. That means they don't get the latest data. So sometimes 2 3 years old data. Sometimes that's not in great shape, but still it's much better than earlier. And good thing is that the global agencies like UN, WHO, World Bank, IMF, etc., they have collected national level data and made them very accessible. And it's very easy to compare data between countries. In fact, most of the data what I have leveraged is they're coming from these agencies. These agencies in turn will collect the data from respective national agencies. The data is credible and it's accessible publicly. So, let's say if you think that I have, kind of hooked up some data, you can go back and check these sources, so, and then, question my data if you wish. Okay. There are many non-profit data platforms in addition to the global agencies like that, with a lot of good analysis, data analysis, and easy to use interface. One of the best things I've seen is the Our World in Data. It says kind of data portal that covers vast amount of data in various areas. So and then made a lot of analysis, visualizations, and easily accessible and usable by general public. It's done by a very limited set of people from Oxford University. So there are other data sites as well, like WRI, World Research Institute, I think. And then Worldometer, Wikipedia, Data for India, India Data Portal, etc. There are also public, I mean, for-profit data platforms as well. And so we can't expect everything to be free. In fact, there is nothing free, right? Even UN, WHO, or the our World Internet, they're all funded by somebody. In this case, there are for-profit organizations. The customers or the data users have to pay some money, and I think the prices are very reasonable. Some of the most widely used as Statista, Macro Trends, and India Stat. Okay, so the session, the topics I'm going to cover are going to answer some of these questions. I'm not going to read all these questions. They're not necessarily in the right order that I'm going to talk through, but it gives a big picture about what uh, things that this session is going to cover. Okay. And many of you might know that United Nations as a sustainable development goals, they want to achieve these goals by 2030, and actually they were called millennial goals by 20. They were supposed to be achieved by 2050. Some progress was made, but unfortunately, still not to be achieved as well. And among these 17 goals, they're all interconnected goals in terms of poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, etc. Right? So all these are all interlinked goals that needs to be that are hoped and visioned and action to be achieved by 2030. Even if you don't achieve 100%, even if you achieve say 60, 70%, 80%, that's a great achievement, right? I think all the governments across the world are kind of working towards it. It gives a good frameworks and also kind of focus on what to kind of areas, focus areas that all these agencies can work on, right? So in that third third goal is the good health and well-being. So I just want to highlight that good health and well-being is the focus of United Nations and various global agencies, and also all the national and regional governments as well. So there's what in this session, what I'm going to cover is so I want to split this session. It's going to be long session. I want to split this into multiple videos so that you can jump to any video you wish. Okay, so the first video with this, giving this context and the background about this whole session, and then I'll also cover the progress that has happened, at least some aspects, I mean some part of the progress. And then I'll cover the other, the progress as well as some of the opportunities and challenges that are there in the health sector. So if you look at the progress in the last 100 years or so, life expectancy has increased dramatically. And I'll give the details about how there's a change in various geographies, which time frame, etc. I'm just going to, this is the kind of summary of that. Life expectancy has increased dramatically over the last 100 years. And we have the maternal mortality and the infant mortality rates. Now, this is some of the major causes of premature unnatural deaths. So they have come down significantly. And also, children had stunted growth and wasted, children. So those things have come down as well. Population at large has been kind of very much in much better health. So they are better fed, physically active for longer ages, longer years. Okay. Many of the dreaded diseases they're contained or eradicated. Some of them, you may recall that polio is largely eradicated. Still, one or two cases happen here and there. But smallpox, which killed the most, near 100 million people killed in the last 80 years, in the 1900s. So that has been eradicated. It's an unbelievable achievement. People don't realize how bad this was. So was influenza. It killed millions. And then TB, it's not eradicated, but we are able to reduce its incidences and also kind of manage it better. Leprosy is kind of largely disappearing, still there, but it's much better than what it was 40, 50 years ago, or maybe 100 years ago. Most of the world's population is vaccinated for common infectious diseases. The access to healthcare has improved significantly. There are hospital, doctors, and cares, and medicines, and emergency care, etc. And the outcomes are also much better. That's why we have the increased life expectancy, right? And the affordability is still a challenge. So in fact, it's becoming increasingly unaffordable. That's a challenge we'll have to look at it. But one side it's unaffordable, at the same time, a lot of people are also able to afford the healthcare, though it's become expensive. With the better health, the economic output and outcome and our material well-being has improved dramatically. So with that, we earn more money and we have more affluence and more comfort, and with that also we can spend more on our health as well. It's kind of a virtuous cycle. So as I said earlier, so we'll look at these some of these progress that have happened in the last 100 years in little more details, much more with the data and visualization of the data. If you look at the life expectancy, as I said earlier, this is one of the amazing change that has happened over the last 100 years. In fact, the data we have some kind of reasonably credible data since 1800. If you can see, there's again the source is from our world in data, so the link is here. You can go and search for this data. And the life expectancy in 1800 was less than 40 years across the globe. In fact, probably in India and all, it would be less than 25 years. Okay, coming to 1950s, it increased significantly in majority of the developed world. It was above 65 years by 1950. In developing world, it was around 30 in the 30s. So India's life expectancy was around 35 in 1950. Global average was 46 years in 1950. By 2015, global average increased to 71 years, where the most of the developed world has more than 80 years as the life expectancy. Whereas in India's case, in 2015 it was 68. Right now it's about 70. We're still below this global average, but looking at where we started, I think it's still amazing. Okay. So with respect to life expectancy, world has made immense progress. It is not just because of the hospitals and medicines alone. It is a lot to do with the food access, transportation, hygiene, better urban planning, and better economic well-being. Those are the other major reasons. But healthcare also contributed to it. Looking at the life expectancy for India in specific, so if you see this till about 1920s, our average life expectancy was around 20 in the mid 20s. In fact, in 1920s, it dropped significantly, probably because of the influenza and the wars that were happening, the famines that were happening, and it started increasing by 1940, 45 it was 32, 33 years. By 1950, it was 35 years. And, so by 2020, we have reached 70 years. Amazing progress. As I said, it's not just the healthcare alone, healthcare in the sense of the medicines, the doctors, nurses, and the treatments, hospitals, etc. Those are one side of the story. Again, with nutrition plays a significant role, and the transportation, communication, and hygiene, clean drinking water, etc. They've all contributed to this improved life expectancy. The next area to look at for the healthcare improvements, health improvement, is the child mortality rate. Say, maternal mortality. Okay, child mortality rate. In 1800s, the nearly 35% of the children would not survive beyond 5 years. That was the sad situation. And this is the global average. Okay? So by 1950, it dropped to 22%, not significant, 35 to 25%. But 1950 to 2023, it's 3.6%. It's really, really a dramatic change in the child mortality rate. And you see that in India, in 1950, it was about 29%. And by 2015, it was 4.8%. We'll look at the India data a little in detail. Okay, so the child mortality, you can see that by region, by 2023, it's you can see that majority of developed world it's less than 1%, and some of the developing worlds, like in Asia and Oceania, Latin America, it's less than around 2%, and the Africa is still a significantly high child mortality rate, 66.3%. And if you look at the in our neighborhood, in 2000, this was 1950, Pakistan had 38% child mortality. Bangladesh is 35%. India at 30%. Okay. World at large was, around 20 to 23%, because India had much higher child mortality than the world average, right? China had 20%. This, I just want to highlight that, China had in the when we got independence in the or decolonized, so China had at least 10-year lead in terms of various human development index, whether it's healthcare, education, physical infrastructure, even the income levels. They had 10-year lead, and India caught up in the 60s, 60s and 70s, even up to 80s. One, India improved, but China also had challenges in 50s and 60s because of their internal civil wars. And but China really took off from the 80s onwards, and it beat everyone else. Okay, so by 2023, you can see that Pakistan has dropped from 38% to 6%. India has dropped from 30% to 2.8%. Bangladesh has also made significant progress, 35% to 2.8%. Okay, and the China dropped from 20% to 7.7%. It's, so this is on par with the developed world. Sri Lanka, is again our immediate neighborhood, right? So they had a very similar, colonial background like us. They, of course, they had, again, just like China, they had much better human development, indexes when we got independence. Their child mortality rate decreased from 15% to 0.61 between 1950 and 20. Overall, it's amazing progress across the world, but the Africa is still a challenge. We'll look into this. Okay, you can see that Africa still contributes to the maximum child mortality rate. Next to the child mortality rate, the child mortality rate in essentially the children dying or not surviving beyond the age of 5. That is the simplest definition. The next major area to focus in terms of understanding the health progress is the maternal mortality rate. Right, so this typically there will be a lot of deaths during pregnancy and childbirth. So, in fact, if you ask your parents or grandparents, they would say how many times they married or remarried, and if they had their mothers survived during pregnancy, etc. There would be a lot of deaths. And you can see that in 1800s, maternal mortality rates, we don't have data from 1800s, but we do have data from 1985 onwards. You can see that, the world reduced the maternal mortality rate from 578,000 to 286,000 in between 85 and 20. Actually, MMR could be anywhere, it could be in 20-30% range if we go back time, so probably 1900, early 1900s. So between 85, by 85, there is a lot of progress that was already made, especially in the developed world and many of the developing world. But between 85 and 20, a lot of progress, further progress has been made. So it has been cut. Maternal mortality rate global level has been cut off. And in Asia, it has dropped significantly. It has dropped by 6 times in Asia. India, we had 174,000 deaths in 83, 85, and we have reduced it to less than 30,000. Bangladesh has made similar progress, almost 1/10 reduction in their maternal deaths. So amazing progress. But Africa is still struggling. You can see that, it accounts for nearly half of the deaths, more than half of the maternal deaths. You can see that the maternal deaths in Africa is kind of flat between 85 and 2020, sadly. So if you look at the regions in our own immediate regions, there's a lot of progress. India has reduced significantly. So are the Pakistan and Bangladesh as well. So I'll pause at this time and then I'll look at the other some infectious diseases that where we have made progress as well. Just to keep the videos relatively short, I'm just going to pause it and then continue later.